Hello everybody, this is Dr. Kalpana Sringar from Prakruthi Charitable Foundation. Welcome to my channel, Tuning a Fragile Mind. Today I'm going to talk about eating disorders. Mainly we can classify these eating disorders into three main categories. One is anorexia nervosa, the other is bulimia, and the third one is pica. So these are the main things that I'm going to talk about today. There are other eating disorders also added to it, but these are the main things which I'm going to explain in brief. First of all, let us talk about anorexia nervosa. In this particular problem, the person will not eat. The person will starve. The person is more worried about the body shape and the weight. So the person stops eating, or assuming the person is forcibly fed, which is really very, very difficult, the person may go and throw up. It becomes so difficult to handle these cases because without any nutrition going into the body and without sufficient food, the person will develop certain behavioral problems. Mood changes will be there, irritation, depression, all these things start cropping up. This particular problem is normally seen in childhood. It starts off in childhood, carries on to adulthood, to teenagers, and then adulthood. But it is really important that you have these people treated at the earliest possible. If you see a person with anorexia nervosa, don't try to just leave them like that. You have to take them for treatment, because without treatment they can never get better. They'll slowly start losing weight and they will not be conscious of themselves losing weight. They feel that they're all right. I remember a case which we had long ago. She was about 15 years old and she looked like a 6-year-old girl. It was a very, very serious problem. She was admitted with this. She had stopped eating. Forcibly, if you'd force her, she would just have about half a spoon or quarter spoon of anything that you'd give her. And she would go to the washroom to throw up. One day, we told her to walk. We made her walk. We said, come on, walk in the garden. You'll feel relaxed, you'll feel fresh, and then you eat a little. We were trying all ways and means to cajole her, to have some rules like token economy, but it was very difficult. I remember to feed her one apple, it took me 2 hours. She had to be put on medication. She was on medication for quite some time. And over a period, say of about 2 or 3 years, she put on a little weight. Medicines helped her. She came out of her problem. And now she's fine. The entire problem is these people will not be aware of themselves. They will not know that they're losing so much weight. The only idea that is in their heads is that they should lose weight, they should maintain a figure. So this is not a disease that you can just forget about it. It's a disorder which really takes a lot of time even for a therapist to help them come out of it. The other disorder that I'm going to talk about is bulimia. Bulimia is a disorder where the person will not have a signal to stop eating. They go on eating. You give them anything at any time, they go on eating. So they go on eating so much that they start putting on a lot of weight. And when they put on so much weight, they end up with a lot of problems, health issues. Blood pressure may go up, or they may have cardiac problems. And most of the people with bulimia, they have issues with their teeth. The enamel gets worn out. They'll have the salivary glands start drying up. They will not be able to move freely because of their overweight. So all these are added problems. So instead, when you feel that a person has this disease, bulimia, see that they are treated properly. Take them to a therapist and see what the cause is. See, when you come to know the cause of the problem, it becomes easy to treat. Find out what exactly is the cause. Why are they eating so much? Is it because a person is depressed? Is it because a person is over anxious about something? Is he worried that something is going to happen tomorrow? He or she must be having something in mind, which is a deep-seated problem. So try to find out what exactly it is. And see that he is treated by a therapist so that he comes out of this problem. It takes time. It takes a long time to treat either anorexia nervosa or bulimia. But when it is treated, the patients feel much better. They come to normalcy, and they become really functional. The other eating disorder which I'm going to talk about is pica, where the patient starts eating anything and everything. He or she could eat hair, clothes, chalk, iron things, anything and everything that's around, they can just pick up and eat. This is seen even in some pregnant women. This is seen in other people also at times, and it is very, very difficult to control because they can pick up anything from anywhere. So you must have seen people eating mud, red mud, or they just pick up anything that's around them. So what happens is many of them land up in hospitals. They develop serious problems. Sometimes they would have even eaten some poisonous thing which could affect them badly. Some of them die because they've eaten something wrong. So this is something which you have to know, and once you recognize that the person is doing it, please take them for help. It is a serious problem. It is not easy. It is not that you can help these people. There are so many people like this. Some go unrecognized because the family doesn't bother. They may feel that, okay, he or she is doing it purposely. We came across a few people who used to say, yeah, this girl goes on eating chalk every day. She eats it, nothing happens to her, she's all right. They don't find out what exactly the root cause is. Probably the body at times craves for certain things. Maybe there's some calcium deficiency in the child. Maybe because of that the child is taking. That's okay. You know, when you come to know that this is the cause for this problem. But even otherwise, people do develop this habit, and then it continues for years. Sometimes it could be really fatal. So if you come across such people, take them to hospitals, hospitalize them for some time, and then bring them to rehabilitation centers, see that they are rehabilitated properly, and they come out of these. The whole problem is these eating disorders are mainly because of especially anorexia nervosa, is because people want to maintain a slim figure. They do not eat carbohydrates. They eat very little proteins. These days it's become like that. Everyone wants to remain very slim and trim. I don't say it is bad, but when it goes to extremes, they could end up with anorexia nervosa. Eat healthy food. Eat in just what is enough for your body. Don't overeat. and see that you have a balanced diet. Nutrition is what counts. You have to eat fruits, you have good healthy vegetables, and if you're a meat eater, you can go ahead with it, but anything should not be in excess. So people with bulimia or anorexia or pica, these people develop a lot of psychological issues. They end up with anxiety, they end up with depression. And there are people who eat and then they go and throw up. They feel that because they don't get the signal to stop eating, they go on eating. So when they eat so much, they feel that they should exercise or they go and throw up. But it doesn't, whatever damage has happened inside your body has already happened. So what are you going to do about it? Instead, the people around them should monitor their eating habits. See that they eat enough. And in case you find that this is because of a psychological disorder that they are behaving like this, take them to a therapist. You will not be able to help them much. The therapists know how to treat them and how to solve their problem. They may need different types of therapies, cognitive therapy, behavior modification therapy, some need rehabilitation. With all this, they'll really come out of it. 90% of them become all right. So viewers, just see in case you have such cases, refer them to hospitals who treat such patients and see that they are out of their disorder. Thank you so much for your patient viewing.